Miss Aria had a band, E-I-E-I-O.
The body has an amazing capacity to do a lot of things to self-heal.
I drum.
The trick is knowing which tool to pull out of the toolbox.
Lorna Keaton's staff is pretty handy when it comes to its many tools.
You start with a point here on your foot.
Does that feel good?
Keaton heads up pain and palliative care for East Tennessee Children's Hospital.
We really run the gamut with more complex pain and symptom management with patients on every floor and in every unit of the hospital.
What are those? Maracas!
Music therapist Joni Pappas works through songs.
It adds an opportunity for me to teach how to use music in a way to cope with anxiety and pain.
Pappas says a simple tune can have a drastic impact on a child's health.
Music is processed throughout the brain, so we call that the turbo effect because it's enhancing, or the brain is comprehending or taking in the information in multiple areas of the brain, so it's even more effective.
Is that okay?
Licensed acupuncturist Jody Tannenbaum's work looks a little prickly.
Most kids fall asleep with acupuncture. It's very relaxing.
But Tannenbaum says acupuncture doesn't hurt, and it helps patients heal.
By placing needles or gentle pressure at particular spots on the body, it affects change. And it's very diverse in what it can treat and how it can treat. But it's amazing how much it can help with pain. And that's, of course, one of the biggest things we see at Children's Hospital.
Right now we're just doing broad strokes for him.
Licensed massage therapist Teresa Combs' hands have a way of relaxing pain away.
How about that?
It's more specifically gauged to their body to get them to relax certain points on their body. We would work with that as well.
She says she once worked with a teenage patient who used visualization and massage therapy to create a happy place.
We went back to when she baked with her grandmother, and so all of her vitals changed tremendously. And in the end, she said, "I can smell that pie that we used to make." To me, that was just well worth all the time it took to get her to realize that yes, she could have a happy place.
Keaton says over the last 6 years, she's encouraged parents to engage with the pain and palliative care team. When they do, she says positive change follows.
What we've shown in 2 or 3 populations is when that's consistently entertained and patients are willing to pull their chair up, those kids use less pain medication, less nausea medicine, and oftentimes can shrink their length of stay.